Dr. Pragati, I have a few more questions to ask you. Do you have a few minutes?
Absolutely, I would love to answer all your questions.
You were mentioning something about this idea called QRATE. What led you to think of this idea, QRATE?
So in my experience, I have come across so many stories that make it very clear that there's a gap in healthcare outcomes for the queer community. Take for example my friend Ria, who went to a gynecologist in Latvia, and she could not explain why, despite being somebody who's sexually active, she's not using contraceptives. When she finally mustered the courage to disclose that she's lesbian, she got such a look of disapproval from her doctor that she never went back. And then there are my medical colleagues. For example, Dr. Anika from Sri Lanka itself. When she first saw a trans woman patient walk into her clinic, she felt completely undertrained and could not treat her well. And myself, as somebody who is a medical doctor and diverse, I could see exactly why there was a problem and why my queer peers were suffering with worse health outcomes.
Do you have some data or evidence to tell us how widespread this issue is?
Absolutely. I mean, the data is unequivocally telling us that there is a problem. Let's establish that there's a problem first. Just for an example, in a country like Poland, in a survey they found that up to 30% of young queer people had attempted suicide. And then Lancet talks about 6 barriers that lead to such poor health outcomes. The first 2 are usually very easy for most people to understand. First being that there is a systematic problem of access when it comes to queer people's ability to navigate through the systems. The second being that a lot of queer people will face some kind of a social stigma and prejudice from individual healthcare workers when they walk into an actual establishment. Take for example these figures. In a country like Switzerland, they found that 62% of queer people said they were fearful of now walking into a doctor's clinic because of previous discrimination practices by them. And back home in India, 82% said they could not name a single doctor that they could trust if they had to disclose their gender or sexual identity. But the third barrier is the barrier that I think most people completely miss out, which is the fact that most medical doctors simply do not get any training on LGBTQIA issues at all. And this has its own adverse effects. Would you believe that in the European Union, up to 50% of doctors said they did not feel competent enough to be able to treat LGBTI patients themselves? So clearly there is a problem.
Okay, this sounds like a real problem. How are you planning to solve it?
So based on a lot of our research, it seems clear that the solution lies in 1, providing the necessary training to close these knowledge gaps. Then verifying and certifying these trained and sensitized doctors. Creating a directory where all of these can be listed with comprehensive filters, and then making it easily bookable for the queer person to be able to access them. That is how we came up with QRATE. It is South Asia's first such impact startup which is handling the entire ecosystem and tackling all the 3 barriers together.
Has anyone else tried solving it?
You would be interested to know this, that in EU, they actually did a very interesting pilot called Health for LGBTI. Between 2016 to 2018, they did a number of research studies, a number of surveys, they built a training curriculum that we've actually used quite a lot in building our own models. We're taking a lot of inspiration from their data, their findings, and even their curriculum courses. The idea is that we supplement their data from the South Asian perspective and hopefully also be able to expand it to EU at some point. Here's a secret, we've already written to them and hopefully we'll get a response as well.
All right, do you want to tell us how QRATE is different?
Honestly, there are so many cool features in QRATE that I don't want to cover all of them, but most importantly, firstly, we are not somebody who's just listing the doctors. We are doing it through a standardized format. Additionally, for a patient to be able to find the best possible doctor for their own needs, we have a comprehensive set of filters for them to search with. Most uniquely, we are not the only ones who will be certifying these doctors. These doctors will also be reviewed and peer rated by the queer community itself. The fact that we are going to be AI-based means that we are easily expandable and scalable across different contexts, including the EU. And last but not the least, we are not tackling just one aspect of the problem, but tackling the entire ecosystem.
Okay, now that you mentioned it's an ecosystem, I understand this is certainly going to help the queer community, but what is it, QRATE, that would help doctors like you or other healthcare professionals?
That's a great question. That is something that I think most people would be having a question as well. Why would a doctor want to do this? The answer is that as a doctor myself, I know that many doctors have a real desire to do better, but need to have their capacities built. Additionally, they're also losing out on a lot of market by not being able to cater to these customers.
Do you have an actual strategy to implement this?
We do. We've actually already done a little pilot study in Delhi, where we interviewed about 15 doctors themselves. We plan to be able to launch our MVP by the end of this year, also in Delhi, and with the support from organizations such as FNF and the European Commission, hopefully, we should also be able to do a little MVP in Germany by the end of next year and hopefully expand by 2025.
Okay, that was a lot of information. Do you mind summarizing the whole idea for our viewers?
Absolutely. So in short, by trainings that are applicable, by directory listings, by peer-reviewed Q ratings, QRATE will be able to improve health outcomes for the queer community, improve access and uptake of services by them, and also as a doctor myself, I can say it will also make the professional milieu better for queer doctors themselves.
Perfect. I know your time is short, but is there anything that you have so that we can connect and others can learn more about it as well?
Yes, there's so much that we can share with you. I would urge all of you all to take out your phones and scan this QR code. We have a lot of material available, including our little cute prototype. Thank you.
Thank you.
I forgot to mention, I guess we charge for this promotion. It's a paid promotion. All right, jury members, over to you.
Thank you. Thank you so much for the presentation, and we can clearly see that there is a problem and you well defined it. And the big part of your project is to train doctors. Where will you find them? How will you access doctors, right? Because we are not talking about 20 or 50 doctors. For this program, for this project to be fully running, we need probably hundreds of thousands. How can you identify so many doctors who will be willing to join you?
Thank you for that. That's a great question, Miloj. One thing that I know from my decade-long work in this field is that we learn best by doing, which is why we want to do things organically and small steps at a time. The reason why we're picking Delhi for our MVP is because that's where I have my own network of medical doctors, my colleagues, the Delhi Medical Association that I'm a part of, the Indian Medical Association that I'm a part of, plus all the NGOs that work in the LGBTQIA sector are also a part of my network. So the idea is to be able to not do this as a silo as an individual, but as a partnership with a lot of other organizations, and then learn by doing and take it from there. It might help you also to know that I've already actually done a few of these trainings with medical doctors, including my own medical college, but also independently.
It's a very brief question that I would like to ask. We all know that it's really hard to convince the government sectors. So are you going to focusing on private sectors or, government sectors or like both sectors?
I come from a government medical college, so for me it's actually easier to do government first, even though I've also done private ones. But yeah, it is surprising. I completely agree, and this is something that I would usually only not say on the mic, but doctors usually don't want to listen to anybody else but doctors. And because I have that leverage, I want to be able to capitalize on it and make a move with that in my pocket.
Thank you. Thank you so much. Can we?
Thank you.
Thank you.